Dizziness is one of those symptoms that can be harmless or a serious warning. The tricky part is that it can feel similar in very different conditions. So the goal here is simple. I'll help you spot the red flags that mean you should get checked sooner rather than later. First, let's get clear on what dizziness even means, because people use that word for different sensations. You might feel lightheaded, like you could faint. You might feel vertigo, like the room is spinning, or you might feel off balance, like you're walking on a boat. Each pattern points to different causes, from dehydration to inner ear problems to heart or brain issues. And your next step depends on the pattern and the context. As we go, think about timing, triggers, and any other symptoms that show up with it. Those details are often what separates watch and wait from get evaluated. Moving to slide 2. Before we talk warning signs, let's do a quick self-check to describe what you're feeling. If it's a spinning sensation, that's vertigo. It often points toward the inner ear, but not always. If it's a faint, floaty feeling, that's lightheadedness, and it can be related to blood pressure, dehydration, blood sugar, anemia, or heart rhythm issues. If it's unsteadiness, like you can't trust your feet, that can come from balance systems in the ear, nerve problems in the legs, vision changes, medication effects, or neurological causes. Next, ask how it starts. Sudden and intense is different from gradual and mild. Then ask what triggers it. Standing up, turning your head, exertion, stress, or eating can all be clues. Finally, note how long it lasts. Seconds, minutes, hours, or days. If you can describe your dizziness clearly, a clinician can narrow the possibilities much faster and decide what testing makes sense. Moving to slide 3. Now for the biggest don't ignore category. Dizziness with signs of a stroke or a mini-stroke. This isn't meant to scare you, it's meant to make you fast. If dizziness comes with one-sided weakness, facial droop, or trouble speaking, that's an emergency. The same goes for sudden trouble seeing, severe new imbalance, or numbness on one side. Some strokes, especially in the back of the brain, can present with dizziness and balance problems more than pain. Another red flag is a sudden severe headache that's different from your usual headaches, especially if it peaks quickly. Also pay attention to new confusion or trouble understanding words. If any of these happen together, don't wait to see if it passes. Time matters for evaluation and for protecting brain function. The safest move is urgent medical assessment when dizziness is paired with clear neurological symptoms. Moving to slide 4. Another situation that deserves quick attention is dizziness with chest symptoms or shortness of breath. Lightheadedness can happen if your heart isn't pumping effectively or if the rhythm is abnormal. If you feel dizzy along with chest pressure, chest pain, a racing heartbeat, or a fluttering sensation, that's a reason to get checked urgently. The same is true if you're short of breath, sweaty without a clear reason, or unusually nauseated. Some people describe it as a sudden wave of weakness, like their body is shutting down. Even if symptoms come and go, an intermittent rhythm problem can still be risky. Also notice if dizziness happens during exertion, like climbing stairs, because that can point toward a circulation or heart issue. You don't need to diagnose the cause yourself. The key is recognizing that dizziness plus heart-related symptoms is not a waited-out situation. Moving to slide 5. Let's talk about fainting and near fainting, because that's a major dividing line. If you actually pass out, or you come close and need to sit or lie down immediately, that should be evaluated. The body can faint from a harmless reflex, like seeing blood, but it can also faint from low blood pressure, dehydration, internal bleeding, or heart rhythm problems. Warning signs include fainting during exercise, fainting without a clear trigger, or fainting with chest pain or palpitations. Also take note if you're injured from the fall, because that adds risk. If you get repeated episodes of near fainting, that matters too, even if you never fully lose consciousness. A useful detail is what you felt right before it happened. Tunnel vision, ringing in the ears, nausea, or sudden heat. Those clues help separate reflex fainting from more concerning causes. Moving to slide 6. A very common pattern is dizziness when you stand up, called orthostatic symptoms. Sometimes it's simple, like not enough fluids, not enough salt, or standing up too quickly. But it can also be related to medications, anemia, nerve signaling problems, or underlying illness. The warning sign is when it's frequent, worsening, or causing falls. Pay attention to whether it happens within seconds of standing and whether it improves when you sit or lie down. Also notice if you're getting new fatigue, pale skin, or shortness of breath with it, which can point toward anemia. If you've had vomiting, diarrhea, fever, or heavy sweating, dehydration becomes more likely. And if you recently started or changed a medication and the dizziness began soon after, that's a key detail to bring up. Getting checked is especially important if you're older, on blood pressure medicines, or have had injuries from sudden lightheadedness. Moving to slide 7. Now let's focus on vertigo, the spinning kind, because some patterns are more concerning than others. A classic benign pattern is brief spinning triggered by rolling in bed or looking up, often lasting under a minute. But you should get checked if vertigo is intense and persistent for hours, especially if you can't walk normally. Another red flag is vertigo with neurological symptoms, like double vision, slurred speech, weakness, or severe new headache. Also pay attention to hearing changes. Sudden hearing loss in one ear, new ringing, or a feeling of ear fullness with vertigo can suggest inner ear inflammation or other ear disorders that need prompt evaluation. If you have fever, severe ear pain, or drainage, infection becomes part of the picture. And if vertigo follows a head injury, even a mild one, it's worth medical review. The main idea is that spinning isn't automatically harmless. The surrounding symptoms decide the risk. Moving to slide 8. Dizziness after a head or neck injury deserves its own category. Even if you didn't lose consciousness, a concussion can cause dizziness, nausea, light sensitivity, and trouble focusing. Whiplash can also affect balance and neck proprioception, which is your body's sense of position. The urgent concerns are different. If dizziness comes with worsening headache, repeated vomiting, increasing confusion, unusual sleepiness, seizures, or weakness, that needs emergency assessment. Also watch for new neck pain with neurological symptoms, because certain rare but serious blood vessel injuries can occur after trauma. If you're on blood thinners, the threshold to get checked is lower, because bleeding risk is higher. And if you hit your head and the dizziness doesn't steadily improve over days, it's reasonable to get evaluated for post-concussion issues and to rule out complications. The key is not to tough it out when symptoms are escalating or not improving. Moving to slide 9. Sometimes dizziness is your body's sign that something systemic is going on, like infection, blood loss, or severe dehydration. If you're dizzy with a high fever, stiff neck, severe weakness, or you feel faint when you sit up, that's a reason to seek medical care. If you've had ongoing vomiting or diarrhea, you can become dehydrated and low on electrolytes, which can worsen dizziness and heart rhythm stability. Another important flag is signs of bleeding. That could be black, tarry stools, vomiting blood, or unusually heavy menstrual bleeding, along with lightheadedness and fast heartbeat. Also consider uncontrolled blood sugar problems if you have diabetes and feel shaky, sweaty, confused, or unusually tired with dizziness. None of these can be confirmed by symptoms alone, but they are strong reasons to get checked because they can progress. The practical takeaway is to look beyond the dizziness and ask, do I feel generally unwell in a way that's new or intense? Moving to slide 10. Medications and substances are a very common and often overlooked cause of dizziness. Blood pressure medicines, diuretics, antidepressants, anxiety medications, sleep aids, some pain medicines, and even some allergy meds can contribute. Alcohol and cannabis can also affect balance and blood pressure, especially when combined with other meds. The warning sign here is a clear timing relationship. You start a new medication, change a dose, or mix substances, and then dizziness appears or worsens. Another red flag is sedation, confusion, or slowed breathing, which can signal an unsafe effect. Also watch for dizziness paired with very low blood pressure readings if you monitor at home, or a heart rate that feels unusually slow or fast. The safest approach is not to stop medications on your own, but to get guidance and review the full list, including supplements. Bringing a written list of everything you take can speed up the evaluation and reduce guesswork. Moving to slide 11. Here's a big practical question. When is it okay to monitor at home, and when should you book an appointment? In general, get checked if dizziness is new for you, keeps recurring, or is changing in character. Also get evaluated if it interferes with walking, driving, working, or basic tasks, because functional impact is a strong signal that something needs attention. If episodes are getting more frequent, lasting longer, or requiring you to lie down, that trend matters. Another reason to book a visit is if you have risk factors like heart disease, prior stroke, diabetes, significant anemia history, or you're pregnant. And if you're older, dizziness can lead to falls, so the threshold for evaluation is lower. When you do go in, bring specifics: when it started, how long it lasts, triggers, and any associated symptoms, like hearing changes, headache, chest sensations, or shortness of breath. Good details often lead to faster, more targeted testing. Moving to slide 12. To make this even more actionable, here's how to prepare for a medical evaluation so you get clearer answers. First, describe the sensation in one word: spinning, faint, or unsteady. Second, write down the top 3 triggers like standing up, turning your head, exertion, or after meals. Third, track duration and recovery. Does it pass in seconds, or do you feel wiped out for hours? Fourth, list associated symptoms, even if they seem unrelated: hearing loss, ringing, headache, chest discomfort, shortness of breath, nausea, fever, or numbness. If you can, note vitals during an episode like heart rate, blood pressure, or blood sugar, but only if you already have a safe way to measure them. Also list recent changes: new meds, illness, travel, poor sleep, or stress. These details help clinicians decide between causes like inner ear vertigo, orthostatic hypertension, arrhythmia, anemia, or neurological issues. Moving to slide 13. Let's wrap this up with a simple safety checklist. Dizziness is most concerning when it's sudden, severe, or paired with neurological signs like weakness, speech trouble, or vision changes. It's also urgent when it comes with chest pain, shortness of breath, palpitations, or fainting. And it deserves evaluation when it's persistent, recurrent, or causing falls, especially after head injury or alongside hearing loss. If you remember one principle, make it this: dizziness plus another major symptom is the combination you don't ignore. If you want, I can also cover common non-urgent causes and how clinicians typically test for them. For now, keep it practical and safe. One quick question for you: have you ever had dizziness that felt more like spinning or more like lightheadedness? Tell me which one in the comments: A for spinning or B for lightheaded. And if you found this helpful, subscribe for more clear, calm health explanations. This information is not a substitute for medical advice.